Well, we've already referred to the heart rate response in that earlier schematic, and we saw that there was a linear-like response for heart rate to exercise intensity. So let's just deal with this in a little bit more detail. Well, first thing is that heart rate in itself is influenced by age. We know that maximal heart rate decreases by 5 to 7 beats per minute per decade. We know it's influenced by state of health. So if you have cardiovascular disease, diabetes, respiratory disorders, you get very, very different heart rate responses both at rest and during exercise. We know that it can be influenced by medication. So for example, beta blockers are used to lower heart rate. Very common drug of choice in the past for snooker players, bizarrely. And also a drug of choice in sports like biathlon, where the athletes will go from very high heart rates during exercise but want to reduce the heart rate in a resting position so that they don't get tremor of the gun. Body position. You saw it on the previous schematic from our study that when we adopt a different position on the bike, we go from this position you can see here, which is an aerodynamic position, to an upright position sitting on the bars. Then we change the heart rate response. And the primary reason for that is that it was changing the way in which gravity acts on the body. That as we go into an aerodynamic position, two things happen. One, the body becomes in essence more, the centre of mass becomes more centrally located, so gravity is acting more proportionally across the body. But secondly, one of the things that we start to see is that as we start to go into more aerodynamic position, we actually start to get a partial occlusion of the femoral artery, the primary artery that's running into the thigh muscle. As we start to get partial occlusion of the femoral artery, that will change blood pressure because you're just blocking off some of the blood flow. If you get that occlusion, the blood pressure goes up. That's going to affect the heart rate response. We know that the type of exercise affects heart rate. So we could be doing the same percentage of VO2 max on cycling versus running, but have different heart rates. Primarily, why? Because of the muscle mass that's involved. In something like cycling, the primary muscle mass that's engaged in the activity is of the lower limb. Yes, you can see in this example there's some upper limb use, primarily in postural control and so on, but compare that to running, where it's a true whole body exercise, or rowing, which is a true whole body exercise. You've also got to take into account that different exercises have different work to rest ratios. So for example, something like rowing has a work to rest ratio of 3 to 1. So you actually are working 3 times more than you are recovering. In something like running, it's a 1 to 1 rest to work ratio, because don't forget you have a flight time in running, and in cycling there is no rest time at all because there's a continual movement. You've either got the eccentric or concentric components of the action. We know that heart rate is affected primarily by hormonal responses such as adrenaline. You may read that as epinephrine, norepinephrine, noradrenaline, cortisol, for example, and also through the autonomic system. So we have sympathetic and parasympathetic control of heart rate. So it's quite a complex response, which sometimes I think we're too quick to simplify. The reason we get interested in heart rate is because it's very simple to record. We can record it using something like a heart rate monitor. It's very cheap to buy now. Heart rate monitor uses telemetric monitoring system. You use the strap that sits on the chest, picks up the electrical activity or conductivity across the heart, and gives us a fairly accurate indication of what's going on. We can also use things like 12-lead ECG if we want a more detailed response of what is going on in the heart. That being the case, the heart rate actually, particularly we're doing graded exercise, where we do a step exercise test, is very useful if we're looking at things like diagnosing certain cardiovascular responses in terms of prognosis, and also if we're going to use exercise prescription. It's very common to prescribe exercise intensities based upon heart rate, because heart rate shows a linear-like response to exercise intensity. Because it's linear, it's fairly easy to divide up the heart rate response and fit that to different exercise domains. So here again we've got our two conditions. We've got our aerodynamic in blue, a non-aerodynamic position in red, and you can see that by changing the position we changed the heart rate. Only marginally, it wasn't a significant difference. But can you see again that from 100 up to about 275 the response is linear for both conditions. So you're getting a proportional increase for a proportional increase in exercise intensity. So for example, if you look at 125 to 150, the heart rate went from just over 100 to about 110 in both conditions. And if you go from 150 to 175, it went from 110 to just about 120. So we're looking at, in this instance, at about 8 to 10 beats increase per increment. So we get this linear-like response to exercise intensity. Now, if we look at the panel on the left, you can see cardiac output related to heart rate, and we've got our three groups. So we've got our untrained, who are our diamonds, our trained, which are our square, and our elite, which are our triangles. So you can see, not surprisingly, as we saw previously, the elite athletes will have a higher cardiac output. So they're reaching cardiac outputs in this instance of about 30 litres per minute. But they're reaching that for a heart rate of 180 beats per minute. If you compare that to our untrained individuals, who for the same heart rate are only attaining probably in the order of 15 to 18 litres per minute for cardiac output. But interestingly, notice something else. The max heart rate is very different for our elite compared to our untrained or even trained. And this is one of the noticeable things, that quite often I think the conception is that the max heart rate gets higher the fitter you get. In fact, it's the opposite. It's the max heart rate gets lower. And the reason it gets lower is this is very much about understanding the idea of cardiovascular range. We know that one of the big responses is that the resting heart rate will decrease. So a standard resting heart rate for the general population is 70 beats per minute. In highly trained endurance athletes, we tend to see values in the region of 40. I've seen values down to about 28 beats per minute at rest. So now if you think about that, you've got quite a large range over which they can work. If we say somebody's got a resting heart rate of 30, they've probably got, and they're going up to about 180 beats per minute, they've got a range of about 150 beats per minute. If you take your untrained individual, they're going up to 200, but they have got a resting heart rate of 70 beats per minute, they've only got a range of 130 beats per minute over which they can work. But it's about then linking it to efficiency. So why does the heart rate come down? Well, it's a bit like thinking in the analogy of going to the gym. If you go to the gym and you do multiple actions, the muscle in essence will start to fatigue. You start to feel that every time you do a bicep curl, the muscle starts to become fatigued. That's a very inefficient process, and that's not really what we want for the heart. So one of the things that we understand that drives the cardiac output up, which allows for the compensation in the reduction in heart rate, is we increase the stroke volume per beat of the heart. And if you look at the panel on the right, you can see that quite clearly. If you look at the panel on the right, look at the difference in the stroke volumes per beat of the heart across the entire heart rate range. Even at low heart rates, so resting heart rates of 60 beats per minute, the untrained and what they call trained have very similar stroke volume responses compared to the elite, who have, well, we're going from, say, let's be generous, 70 mils per beat up to about 90 mils per beat. But if you now go right up to max heart rate, in this instance we're getting close to about 200 beats per minute in our untrained and trained, and 180 beats per minute in our elite. The elites have around about 190 millilitres of blood per beat of the heart, compared to in the region of 120 to 140 millilitres per beat per heart, millilitres of blood per beat of the heart. So you can really see, and that's a much more efficient process. You can really see that the max heart rate starts to fall because we have an increased pumping capacity of the heart. And this really alludes to one of the key adaptations that you see with endurance training, is that we get both an eccentric and concentric hypertrophy of the heart. That is, the concentric hypertrophy reflects the fact that the muscle on around the left ventricle starts to get thicker. So in other words, we can squeeze harder, so we can increase the ejection volume per beat of the heart. The eccentric hypertrophy of the heart reflects the fact that the ventricle itself gets bigger, so it becomes stretched. So we go from like this size, and it becomes stretched over time, and that's because more blood is being pushed into the ventricle per beat of the heart. So, assuming that it's more efficient to be able to eject more blood per beat of the heart, because that means we're delivering more for less work, you can understand why the max heart rate starts to decrease over time, because the heart has got in itself physically stronger, because you've got the eccentric and concentric hypertrophy of the left ventricle.